Today I will be demonstrating the insertion of Memokath 051 ureteric stent. The Memokath 051 ureteric stent is a nickel titanium alloy stent that is heat sensitive, and it is used for patients that have chronic obstruction of the ureters, most commonly for malignant disease or complex benign pathology. The advantages of Memokath 051 are that this stent is easy to perform, it is a day procedure, and this will reduce the number of times that the patient will have to go for repeat stent changes in patients that have either malignancy or chronic benign disease. We are setting up for the procedure of the Memokath ureteric stent. We are setting up normal saline as part of the irrigation fluid, and here you will be seeing the II coming into position. We're doing a cystoscopy. We have identified the ureteric stent, and we will be removing the stent. And now we will be doing a retrograde pyelogram to identify the length of the stricture. This is the retrograde pyelogram, and we will be marking the stricture site, and we will be putting two needles on the surface so that we can have a measurement of the length of the stricture. So what we're doing now is, at the moment we have put the markers on the patient to look at the stricture. You can see here the length of the stricture, and now we're doing the measurement of the stricture length. Once we have done the measurement, we are opening up the ureteric dilator, which is part of the Memokath package. In this dilator there's also a guide wire. So what we'll be doing now is we're putting the... You got some jelly? Is there? We have got now the guide wire, and we will pass the dilator through the guide wire. As you can see here, now the dilator is being pushed over the guide wire, and this will go beyond the level of the stricture. It's very important that the dilator is passed beyond the level of the stricture. We remove the inner sheath, and the guide wire comes out, and you can see that there's urine now dripping. That's a very important sign that you're in the right place. You can see the urine dripping there. Here, we take this off. Take this off, and this comes apart. Now this is our stent. Have you got the hot water ready?
Yes.
We're getting it now. Okay. So what we're doing now, this is the Memokath ureteric metal stent. It's got these plastic bits here that actually hold the Memokath. It's a bit hard to see that on the monitor, but you can see these almost like a plastic clip that holds it in place. And it will hold it in place as long as the actual titanium coil is not expanded by using the hot water. Once we pass the hot water through the open-ended area, the whole thing here will uncoil, and it will be positioned in the area which is dilated. The stent is inserted through the dilator, and it is locked in position. We need to move the stent above the proximal marker where the proximal end of the stricture is. Taking the hot water, which has been pre-warmed up to 60 degrees, we load it up in a syringe of 60 ml syringe, and then we take the inner sheath and we inject very quickly the 60 mils of the hot water, and you can see now the stent uncoiling at the top end. Now we are doing the cystoscopy and the retrograde pyelogram, and this is to check the final position of the stent to make sure that the stent has not migrated and it's in good position. The Memokath stent has got minimal side effects. It is well tolerated, does not cause any bladder irritation, and it would be easy to remove it if required. And the other advantage of the Memokath 051 is that it does not easily encrust, and there is no tissue ingrowth. Memokath 051 is easy to perform. It has the advantage that it does not cause any irritation in the bladder, and it's also not prone to incrustation or tissue ingrowth. The indications for insertion of Memokath 051 are malignancy, which involves then retroperitoneum and causes obstruction of the ureters, which can be either unilateral or bilateral, and also in patients that have chronic obstruction of the ureter, but they are not suitable to have reconstructive surgery for the obstructed ureter. The relative contraindication of performing Memokath 051 would be patients that have recurrent renal calculi, the patients that have less than 10% renal function on that kidney that is involved, and also in patients that have got fungal infections. I do thank you for watching this presentation. Memokath 051 metal stent has been used now for 11 years with very good track record in suitable patients. This stent is easy to insert, and also when appropriate it's required to be removed, then it would be easy to remove. Memokath 051, when it's used in the appropriate cases, especially for those patients with malignant disease and chronic benign obstruction of the ureter, has got very good results.